Jeffrey, the only guest we have with his own theme music. That was our first dance song, by the way, our wedding. By now, most of us are already thinking about the weight we're going to have to lose after the holidays. And here to tell us about a weight loss program that really works is Aesthetic Medicine's Dr. Jerry Darm, along with one of his patients, weight loss patient Sara Truby. Nice to have you both here. Sara, you lost 35 pounds. You look fantastic, by the way.
Well, thank you.
You lost 35 pounds, and you have maintained that weight loss now for how long?
For a year.
Unbelievable. For over a year, actually.
Yes, actually, it's a little bit over a year.
I want you to be straight with me. Over a year.
Okay.
Yeah.
And
that is hard to do, isn't it? I mean, a lot of people will lose a little bit of weight and then they gain it back.
Yes.
Did you try other diets before?
I have tried other diets, and it seems as I got older, I had more problems losing weight. And so I was really determined, and I actually did it over the holidays last year, where I lost the majority of my weight.
We have pictures of you before and after. Do you remember this, Sara?
Oh, yes, I do.
Wow. You look fantastic.
Thanks.
So, Dr. Darm, how does this weight loss program work?
Well, this is medically supervised, and it's called the LCD. It's a food holiday. You go away from food for a while, take these deliciously satisfying shakes, and the weight just sort of melts off, you know. The average patient loses 40 to 60 pounds.
Wow. So, sir, why did this work for you when other diets hadn't worked for you?
I think because of how the office staff is really involved with you. You have a nutritionist, you have a dietitian who's calling and checking up on you. You have classes. You're having your medical.
So someone's monitoring you at all times.
Exactly.
And it's accountability too, isn't it?
Accountability, and also they're watching your blood pressure and your cholesterol, which I think is really, really important.
And a lot of people, when they lose weight, a lot of times, doctor, they'll fast, they'll radically change their diet, they lose the whatever number that they want to lose, and then they go back to their old way of living.
Which is why you have a maintenance program, basically. You've got to change some habits. You know, you've got to, begin some exercise. Walking 3 miles a day is a 30-pound habit. Taking a shake for breakfast and lunch is a 20 or 30-pound habit. So that's the things that have to change. Maybe you end up with 1 meal a day instead of 3.
So you're also retraining the way people think about what they put into their body and how they fuel their body.
Totally.
Yeah.
Now, Sara, you also were telling me before the show that you just finished your first marathon.
I have.
In Hawaii, right?
I did. I finished the Honolulu Marathon on Sunday. It was 26.2 miles.
And before that, you'd been doing half marathons. Is it the weight loss that got you energized and motivated?
Yes, it really is, because I felt like a whole different person once I knew how to eat properly for a lifestyle.
And so now, as you go through everyday life, over a year later, do you look at foods and say, well, I can't have that, or are you depriving yourself of things,
No.
or are you measuring your consumption?
You're measuring and seeing what you're eating. You're adjusting things so it's healthier, and they give you the tools for that.
And the early part of the diet, the food holidays you mentioned, that creates a kind of a rapid weight loss. Is that right?
Well, it takes the appetite away. It's very interesting. It's kind of an Atkins principle. The shakes are high in protein, low in fat, low in carbs. So it's kind of the Atkins principle, and your appetite disappears, and that's why so much weight is lost. Plus, blood pressure drops, diabetes gets better, cholesterol profiles improve, and we measure all those during the course of the
program. Very good. Well, folks know if they'd like a free consultation, contact Aesthetic Medicine. They're over on Southwest Shady Lane in Tigard. Phone number is 503-697-9777, and we've got information on our website at katu.com.
Thank you, and congratulations again. You look
I'm guessing with the holidays, maybe we can make it 42 pounds.
I'll see you after.
Oh, yeah.